I recently received a private message about Congregate Living and how to start it. Hi, my name is Rhea, the care admin. Let's get into this. The first thing we need to explore is that Congregate Living is a general term, not a specific California license. This type of business model describes a shared living arrangement where multiple unrelated individuals live together and receive services. The type of license you need depends on who you're serving and the level of care you'll provide. This type of business model is not regulated by the CDSS, but rather the CDPH, or California Department of Public Health. So according to the California Department of Public Health, a CLHF is a licensed residential healthcare facility that generally has no more than 18 beds and provides inpatient care, including medical supervision, 24-hour skilled nursing, supportive care, pharmacy services, dietary services, social and recreational services, and a specialized care for certain populations. These types of facilities usually serve individuals who are mentally alert but physically disabled, including those who are ventilator dependent. Also for individuals with a terminal illness or life-threatening illness, individuals who are catastrophically and severely disabled who can benefit from rehabilitation services like physical, occupational, or speech therapy. And as I've stated, unlike the RCFE and ARF facilities, which are both licensed through the California Department of Social Services, a CLHF is licensed by the California Department of Public Health because it's considered a healthcare facility. If you're thinking about opening one, CDPH says that your first step is to download the official initial application packet. Your application includes ownership documents, organizational information, administration information, and resume, proof of property control such as a deed or a lease, floor plans, fire safety documentation, transfer agreements, policies, and other supporting documents listed in their official provider checklist. Pause for the link here. Once your application is complete, you submit it to the CDPH Centralized Applications Branch. After they review it, the Licensing and Certification District Office conducts an on-site licensing survey before a license can be issued. One thing that's overlooked is staffing because CLHF is a healthcare facility, so technically they're patients. You'll need appropriately qualified clinical personnel. And depending on the role and your facility's credentialing and billing requirements, registered nurses, licensed vocational nurses may also need an individual NPI or National Provider Identification Number. The facility itself generally has its own organizational NPI used for healthcare transactions and provider enrollment. This means that your facility will need medical documentation and reimbursement becomes much more complex. And depending on the payer, such as Medicare, Medi-Cal, or private insurance, you'll typically be dealing with ICD-10-CM diagnosis codes to document the patient's medical conditions, and you'll have to do medical billing and claim submissions either through an in-house billing department or a contracted medical billing company. You also need, like I said, clinical documentations from your physicians, RNs, therapists, and other healthcare professionals to support reimbursement. Then you have your Medicare and or Medi-Cal provider enrollment if the facility participates in those programs. As I mentioned, your facility will need the national provider identifiers for the organization and applicable individual providers involved in billing and credential. This is different from RCFEs and ARFs because RCFEs generally charge a monthly private pay rate for housing and personal care and do not bill Medicare or Medi-Cal for room and board or routine custodial care. You'll most likely need to hire somebody who has the expertise in areas like ICD-10 diagnosis coding, medical billing, healthcare reimbursement, Medicare and Medicaid regulations, clinical documentation improvement or CDI, and HIPAA compliance and revenue cycle management. Everything I share comes directly from the publicly available information from the CDPH and federal healthcare resources, and this video is for educational purposes. But if you're interested for more, I will be making follow-up videos soon. There's so much information, the structure, how it's run, and who's in. The next videos are where I'll explain what it actually costs to open a CLHF in California. So please stay tuned. I'm Rhea, the care admin. I'll see you next time.